Moving on to white blood cells. White blood cells, there's more than one type. So red blood cells, there's one type. White blood cells, we're going to categorize into different ones. So white blood cells are called leukocytes. So erythro, think red blood cells. Leuko, leukemia, leukopenia. Leuc deals with white blood cells. So leukocytes are very important against diseases. And white blood cell counts, when you talk about cancer or infections, things like that, they become very, very important. So hemocytoblasts are those stem cells that I talked about with the red blood cells that all of your cells come from. They're formed in the red bone marrow also. And then there are hormones that will stimulate white blood cell production. There's two categories, interleukins, Leuc again dealing with white blood cells, and then colony stimulating factors. So those are the two main categories that will stimulate white blood cell production. White blood cells can actually leave the bloodstream. Red blood cells stay in the blood. They're transported through the vessels. White blood cells can actually leave the vessels, and they only live 12 hours. Very short lifespan. White blood cells do not live very long. They work hard when they are alive. 5 types. We're going to look at 5 types of white blood cells. They're categorized by their size, how big they are, whether they're grainy in appearance or not, the shape of the nucleus. Not all of the nucleus are going to be nice and round. And then the staining, how they take on stain. So the types are the two main categories. Granulocytes, they're going to have a grainy appearance. Agranulocytes, not grainy. Cyte means cells, so grainy cell, not grainy cell. Neutrophils, eosinophils, and basophils are your granulocytes. And then monocytes and lymphocytes will be your agranulocytes. So, what they do, what they look like. Neutrophils are going to take on a purple-looking stain, and here's that grainy-looking appearance that I was talking about. They comprise or compromise 54 to 62% of white blood cells. Remember, white blood cells are only like 0.1% of your whole blood. But of those white blood cells, neutrophils are the most common. And notice this appearance of the nucleus, it's multi-lobed. It's not one nice little round nucleus in the center. Eosinophils, very coarse, grainy looking appearance, and they actually stain darker and will have more of kind of a reddish instead of purple appearance. 1 to 3%, so not a huge amount. And like I said, if you have allergies, you'll have more eosinophils than somebody who doesn't have allergies. Also notice size and amount. All of these are your red blood cells. There's very few white blood cells that you will actually see. Basophils, very blue looking, less than 1%. So if I give you a slide of a blood smear, it's very hard to even find one of these on that slide because there are so few of them. Very grainy, very blue, baso-blue looking. Monocytes are bigger. They're the largest white blood cell. They're the largest blood cell, period. Nuclei, variable shape means that you can't really categorize it one way, but the nucleus is usually very large, period. The nucleus is going to take up a large amount of the cell. 3 to 9%, so a little bit bigger percentage again. And then lymphocytes, this would be the second largest amount, 25 to 33% of your white blood cells. So after neutrophils comes leukocytes. They live a little bit longer, and they have typically the round nucleus, but then again, it's large. So monocytes, lymphocytes both have very large nuclei. And like I said, 25 to 33%. So typical way to find a lymphocyte is that huge nucleus is round in the middle, and it takes up almost the whole cell. So we said that leukocytes can actually leave. Diapedesis is that term used when a white blood cell actually goes between the cells of the blood vessel and comes out. And the reason they can leave is because most white blood cells are going to get rid of something in your body that you don't need or you don't want, like bacteria. So when they leave, they are going to go to destroy some type of bacteria or debris that's found in your system. Neutrophils and monocytes are phagocytic. They're phagocytes. They're going to eat, destroy things. Monocytes are going to actually eat larger things, so macrophages. They're going to get rid of bigger materials. Both of these contain many lysosomes, which if you remember from biology, help to get rid of, engulf and get rid of things, and then break them down. So neutrophils, monocytes, they are going to engulf, eat, get rid of many, many particles. Eosinophils moderate inflammation. That's their job, and that's why people with allergies have more of them. People with allergies, inflamed, stuffy noses, things like that. Eosinophils are trying to get rid of that, and that's why people with allergies have more. Also, if you have a parasite type of infection, which in our area is not very common, but eosinophils also help with that. And there's just a picture of the white blood cell squeezing through the blood vessel. Basophils are going to, if you damage, if you cut yourself, basophils are going to immediately go to that damaged tissue. They release a histamine to promote inflammation and heparin to inhibit blood clotting. So when you sprain your ankle and your ankle swells, that's a good thing. That's allowing movement of other white blood cells there. Basophils are going to help with that and allow inflammation of that area. Lymphocytes are very important for immunity, and that's their main function. B cells, antibodies, so like when you have the flu shot and you build up antibodies for that, lymphocytes are important there. Any other immunity type things, measles would be an example. Most of you have had some type of shot to help you become immune because your body then will produce antibodies for that. We'll talk about blood cell transfusions later, and that will be important there. So cubic millimeter, remember it was millions for red blood cells. Now we're down to 3,000 to 10,000. So white blood cells there's a lot less of. Two disorders, I'm going to call it. Leukocytosis. After an infection, you're going to have a spike in white blood cell count. So if you have strep throat, you're going to have leukocytosis. You're going to have an increase in number of white blood cell count. Leukopenia, too few white blood cells. A lot of times that might deal with a virus, such as AIDS. So you're not going to have enough white blood cells, and that's why AIDS patients, their immunity becomes very low. They don't have the normal number of white blood cells that an average person would have. Differential white blood cell count, CBC, sometimes is just the control blood panel. Differential means I'm actually going to look at how many neutrophils, how many lymphocytes, how many monocytes. A normal blood cell count will just say you have this many white blood cells. You have this many red blood cells. Differential actually splits them into categories. I can help pinpoint whether, if your neutrophils are up, probably bacteria. Eosinophils are up, maybe you're having an allergic reaction to something. So they can look at the different types and see what they think is the underlying cause of your condition. Blood platelets, we'll start a little bit today, we'll talk about more next time. Blood platelets, scientific name, thrombocytes. They are pieces, they're not whole cells. A platelet is a broken fragment of a megakaryocyte, so it's a fragment of a huge cell. Here again comes from the same stem cells that all of your blood cells come from. And thrombopoietin is basically the chemical that stimulates the production of platelets. So if you cut yourself, that's going to stimulate more platelets to come and clot that bleeding area. So their job is repair and clotting. They're going to show up and repair damaged blood vessels. They work well because they are broken, so they get caught on each other and then they build and stack on each other to help form a clot. Normal platelet count varies probably a little bit more than the others, 150,000 to 350,000, so kind of in the middle. And here is the table that you can look at that shows all of your different blood cells. Their function, do make sure you look at the function part and know what they do. And then probably you should know neutrophils are the most common white blood cell. You should know that red blood cells are the most common type of blood cell that you have. And platelets are fragments, they're not a whole cell. So there's a few pieces there. And we'll stop and talk about blood plasma next time.